Okay, for those that are on the call, we will be starting here in about 4 minutes. If you get here early, go over to the chat box over on, I believe it's on the right-hand side of the screen. You can go ahead and type in your questions. It's a Webinar Jam chat box. I just sent out a link that if you are a member, you would have received that right in your inbox. To click on it, it'll bring you right into the video with me right here, live. We'll be starting here in just a minute. Go ahead and start leaving your questions over here on the right in the chat box. And if you members would have received a live link to click on in their inbox, I just sent it out. It was probably 1:51 Eastern time, so it was about 8 minutes ago. And that should be in your inbox. You can click on that, and it'll bring you right live into the Hangout with me, so we can talk like on a phone, but we can see each other. We are going to be starting in 5, 4, 3, 2, 1. Okay, well, we've been live, but I'm just waiting for people to show up, and I've always had challenges with the technology. There's something about we have the Google Hangout, and then there's this Webinar Jam thing, and it integrates with the two, and sometimes it takes a little bit, so I need to start it beforehand to make sure when we start on time, we're actually starting on time. And with that being said, I want to welcome you to the call. This is the Platinum level knee pain elimination program. This is our call, our bi-weekly call every other week, where we go over your questions that you have about what's going on with your knees, and based on the work that you're doing in the virtual knee pain clinic, how it's going, like what's changing, what's shifting. And based on that information, based on that feedback, that's going to allow me to help you better. And the more feedback, the more information you give me, the better job I'm able to do for you and with you, because that feedback is crucial. And we're talking about it's essentially a very different path that you're going down when you're working with the Knee Pain Guru program, because we're focusing on comfort and we're focusing on setting up the conditions so our body can take advantage of the comfort once you experience that. And comfort is the fastest way for your body to get out of pain. And don't let anyone else tell you different. Think about it from a logical standpoint. If your body is comfortable, if your knee is comfortable and it doesn't hurt, you don't have knee pain. I know it's kind of like a duh, Bill, of course. However, most people don't think of it that way. From a Western medical model, they're trying to put you into a box as far as what's going to work, what's going to get you out of pain, what muscles in your leg you got to strengthen in the hopes that your knee is going to get out of pain. And essentially, it's like a crapshoot. And that's why so many people are in pain, and so many people are developing arthritis, and so many people are lining up for knee replacement surgeries every year. They're following an obsolete model, a model that doesn't work, a model that causes the joint to degenerate faster. And that's not to mention all of your life that passes you by, all the quality times that you could be having with friends and loved ones and doing activities that you like doing. You're sitting on your ass on the couch and you're not doing anything. So we're going to change all that today, starting today. So start putting in your questions over on the right. Okay, a few more things is participate. That's how you're going to get the feedback, is when you participate. And there may be like, oh, Bill, but I don't want to take someone else's spot. Well, tough shit for them. If they don't step forward and they don't ask for the help, you ask for the help. And what that's going to do, that's going to get you out of pain. And then when they're ready, those people can ask the questions. They could step up. And that's one of the things that I found with knee pain sufferers, myself included, is we're very driven, but we don't want to stand up and help ourselves. I haven't quite figured that out. I can't tell you why. I don't have the psychology of it, but all I'm saying is participate. Ask questions, get feedback. And that's going to make a huge difference for you. And, the clients that I work with, they get out of pain fast because we're getting the pressure off of the nerves that are causing the irritation, creating comfort, and then the body's just out of pain. I was actually talking to Jose earlier today. He's supposed to be on the call with us today. He was getting some great results, and we definitely want to get those results for you because you deserve those results. There's no reason you need to be hobbling around, limping around, letting your life pass you by. Okay. So now we're going to get into some questions here. I had a couple of questions that were sent in. This question is from Jennifer. She had a knee replacement on June 17th, only at 106 degrees flexion. And the physical therapist is going to do deep massage, who does metacupping and is trying to loosen scar tissue also from a previous surgery in the same spot. Any other suggestions to regain flexion? My surgeon has told me to call him if I wanted to manipulate my knee, which I do not want to do. And good reason. Manipulation of the knee is very painful, especially if the knee isn't fully flexing. Now I'm going to talk about some concepts that are a little bit, it's going to be a little foreign to someone that doesn't really embrace my approach. Well, it's going to be foreign to most everybody because only the people that have worked in my program are really going to understand what I'm talking about. In order for the knee to fully flex, the hip needs to be fully free as well. And the knee will play a role, the hip will play a role in the flexion of the knee. So in order for the knee to fully bend, it needs the hip freed up. If the hip's not freed up, what ends up happening is that you can't get full flexion out of the knee. It's really, really difficult to do. So the first thing I would look at is freeing up the hip. You got to free up the hip. And with that being said, there's some specific stretches in the passive stretching section of the virtual clinic, stretching lounge, passive stretching section, that are going to make a huge difference. So let me find those for you. They're going to be modules 23. Actually, modules 23, I want to give you a few more. Modules 23, 9 through 12, and 23. Those are going to begin freeing up the tension in the hips. Once the tension in the hips begin to free up, then we're going to see what's going on in the knee. It's going to start helping. It's like a teeter-totter. You know, one end's up, the other end's down. One end's up, the other end's down. So we start loosening up the hip. We're going to start loosening up the knee as well. I'd also like you to work with modules 1 and 2 in the passive stretching section to free up the rotation and the relationship of the tibia and fibula in the lower part of the leg with the femur in the upper part of the leg. That's going to make a big difference as well, because many times the ability to flex the knee is a result of the bones aren't lined up correctly. Now with the knee replacement, you're going to have an additional dynamic going on because there's plastic and metal in the knee. There's going to be a dynamic there that it's something that I don't totally know about, nor is anyone else, because no one knows how the doctor cut off the bones in your upper leg and lower leg and replaced it with plastic and metal. That's a fact. For all the people that are listening, pay attention, because if you're thinking that a knee replacement surgery is going to be a quick fix solution for addressing what's going on in your knee, you're wrong. Because what ends up happening is you don't feel what's going on in the knee, the tension pattern, the body has to compensate somewhere else. And I got a doctor friend in Southern Indiana, a doctor, general practitioner, who had both of her knees replaced back in 2010 and this year had both hips replaced. Bionic woman, you know, wears it like a badge of honor. But, you know, it's going to shift somewhere else, and you're going to be looking at spinal fusions or some other crap like that in the short term, because the body's compensating. It's got to go somewhere. We can't ignore this. Got to look at what's going on and understand it on a deeper level. Otherwise, it's like what Einstein or what they say about insanity, doing the same thing over and over and expecting a different result. Just not going to happen. Anybody goes against nature doesn't win. The body will win out. It's just not what you're going to like. So there's that. We're going to address the tension in the hips, see how that shifts what's going on. We're going to address the tension in the relationship of the bones in the lower leg, the bones in the upper leg, with modules 1 and 2. See how that begins to change. Now we want to look at the rotation of the bone in the upper leg. This one was huge for me. And this was like a personal story for me. After the surgery, after the physical therapy, I went to, got fitted for this DonJoy knee brace, big titanium knee brace. You've seen them, professional football players wear them. They wrap around the front of, actually it goes around the calf in the back. It goes up the sides of the leg and it goes around the front of the thigh. Big friggin' honkin' knee brace. Titanium. It's like swinging an axe when I was coming into a throw in judo. And what ended up happening is I really couldn't train the way I wanted to. But oh my gosh, I lost my train of thought. But the point of what I'm saying is that what was it? Oh, the rotation. I wanted to kneel. The rotation of the upper part of the leg was inhibiting my ability to fully flex the knee. So my knee couldn't fully bend because there was a rotation going on in the lower or in the upper part of the leg that wasn't allowing the relationship of the bones the room that it needed in order to fully flex. So I want to give you that stretch that helped me in like less than 2 minutes, made such a huge shift in my leg that I was able to kneel in judo. It actually shifted the scar a 1/4 inch on my leg, so I wasn't kneeling on the scar anymore. Really, really cool stretch. So I want to give that to you right now. That is, okay. We are in the stretching lounge, past the stretching section, module 32, the femur rotation. So that's a phenomenal stretch. And it works with the intrinsic movement of how the hip or how the femur sits in the hip joint by creating, taking the tension pattern off of what's going on. So that's going to be real big. So working with, once again, we'll cover that, modules 1 and 2 for the knee joint itself, modules 9, 10, 11, 12, and 23 for the hips, and then module, where'd it go? (32) for the rotation of the femur. So work on those. That's going to make a big difference for you. It's going to start changing what you have going on. Okay, now to the next question. Next question here is from Ray. Because of knee pain and possible bone-on-bone conditions, I can't run or jog anymore as my knee feels locked in a vertical position and does not allow for bending while trying to run. I have become bow-legged, yet can't walk, exercise at the gym. I have become bow-legged. I can walk and exercise at the gym, but no running. I can bend my knee without pain, yet a side-to-side sliding of my knee brings pain. I have been told that total knee replacement is in order, yet I'm hesitant to have metal and plastic put in my knee and go through the invasive surgery. Any hope in another solution to allow jogging? Absolutely. Follow my program. It's kind of simple. You know, I've been in martial arts 25 years, and a lot of people have the secret. Like, what's the secret, Bill? What's the secret to martial arts? Well, the secret is you show up. You show up and you do the work. It doesn't have to look pretty. You don't have to be the best. Like when you're doing your technique doesn't have to look great, but you got to show up. And the people that get better are the ones that show up. So that's the secret. What you want to do, though, is I'm going to give you the specific stretches based on what you're telling me. I would do modules. This is in the stretching lounge, past the stretching section. Watch the intro video. Do modules 1 and 2. The side-to-side motion of the knee, I would work with. Where is it? Side-to-side motion of the knee. Oh, module 36 for the side-to-side motion. We're going to see what's going on with the knee as far as that. So intro video, modules 1, 2, and 36. And then I would also do modules 22 and 23. That's going to address what's going on in the hips and the lower back. 1, 2. What? Wait a minute. The side to side. Where is that? Where did I just? Okay. Ugh. Module 36. So 1, 2, and 36 are going to work with the bending and the straightening of the knee. Actually, let me dial that in. It's not just 1 and 2, being that it's difficult with bending it. I want you to do module 1A and module 1A and 2 and 36 for the knees. I want you to do that. Spend 10 to 15 minutes in the morning, 10 to 15 minutes in the evening. Minimum. If it feels good, then do it more often. Then do modules 22 and 23 for your hips and your lower back. Spend about 10 minutes in the morning and then 10 minutes in the evening before you get out of bed and before you go to sleep. That's going to help relax the tension in the hips and the lower back. That's going to pull the tension out of the knees. It's going to make a big difference for you. So do that, and then that should be good. That should be a start. And, Ray, let me know how that goes for you. Okay, Nancy here. Had a horse fall on me 3 months ago. My major injury was a broken left femur. As a result, I have lots of scar tissue on my knee. Had manual manipulation 5 days ago and went straight to PT from there. They put me straight to a flex board to get 90 degrees bend. I am so stressed and tight because the pain is excruciating. I know this is not helping me with mobility. Please help me relax so my body can also relax and let go of tension. This is worse than the 15 bones I broke in the accident, and 10 of them were ribs. I have about 40 degrees of motion on my own. Thank you for the video. It makes perfect sense. And I want to go into this direction for relief and realistic plan to get myself where I can walk again. Okay, Nancy. Man, that was a rough one. Okay, let's see what we can do. Here's what you go into the stretching lounge, passive stretching section, intro video, modules 1 and 2. That's gonna have some high leverage for you there. As far as the scar tissue, look at Dr. Frank Charles's Ultimate Supplement list. There's some scar tissue. There's some enzyme formulas in there that helps break down scar tissue that I believe you'll find very valuable. So that's going to address scar tissue. The other stretches that I'd like to give you are going to be Module 42, the skin twist. And I'd like you to do the skin twist all up and down your leg because you have there'll be a lot of scar tissue that's going on in there. And I'd also like for you to work with Module 45, which is specific pain point scar tissue. And this is going to be especially helpful where incisions were made in the knee for surgery and where the larger rotational movements doing the skin twist is going to it's going to be too much. The skin twist is going to address those fascial tension strains or the connective tissue strains that end up in the body as a result of the compensation patterns. So modules 1, modules 2, modules 42 and 45. That's going to help with what you were telling me do modules 22 and 23 10 minutes before you get out of bed in the morning, 10 minutes before you go to sleep. I think that's going to be helpful for you. Look at Dr. Charles's ultimate supplement list as far as the scar tissue, the supplements that he suggests for scar tissue, and get this moving. It's not going to take you a long time to get yourself out of pain. I know it may seem like that right now, but in actuality, when you start doing the things that create comfort, getting out of pain is actually, you get out pretty quickly. So yeah, that's what I would do. And you check in with me in a couple of weeks. Let me know how that goes. Let's see. Do we have any other questions? I'm not seeing any other questions here. I'd encourage, if you're watching this, follow me on Periscope. It's at the Knee Pain Guru. Same handle on Twitter, at the Knee Pain Guru. Find me on Facebook. Look for the Knee Pain Guru page. I'm on there. I'm posting videos, answering questions, things like that. I'm here to help. If you don't utilize me for that, well, then that's your own fault. You gotta step up. You gotta do the work. I'll be there to help and support you and guide you, but you got to take that first step, because there's no sense me chasing after you. One, I'll catch you real quick because you got knee pain. But the second point is, it's like the whole adage, you can lead a horse to water, but you can't make him drink. So if you want the help, I'm here to help. If you don't want the help, that's cool too. You can suffer by yourself. Doesn't bother me in the least bit. My knees are good. Okay, that's a wrap for today. Those are all the questions I have. We will, unless someone just popped in on the call, unless you start asking questions over in the chat box, I'm going to wrap this call up for this week. We will be on the next call. It's going to be the 24th, I believe. Yes, the 24th of September is going to be our next call, and we are going to cover the next, that'll be of the next platinum level knee pain elimination call that we will go over. So thank you for showing up. It's an honor to be able to serve and help you with what you have going on with your knees. And once again, I'd encourage you, follow me on Periscope, at the Knee Pain Guru, same thing on Twitter, on Facebook, the Knee Pain Guru, and I'd encourage you to participate. Participation is what's going to get you out of pain the quickest, because I'll be able to make those distinctions. So, okay, thank you so much. I will see you next time. Have a wonderful day, and I will talk to you soon.